Thank you for listening to this short presentation on Prospect, a new clinic at London Health Sciences Centre for young people at risk for psychosis. This presentation will take approximately 10 minutes and is designed to provide information about this innovative new program, including information on how to make a referral. Individuals who eventually develop psychosis exert subtle warning signs prior to experiencing an acute first episode. This pre-psychotic state has been termed the prodrome, or clinical high-risk state. There are now CHR programs all over the world, and many have been showing promising outcomes. Waiting to intervene until after psychosis develops is inevitably associated with more functional decline, which can actually be prevented if supports are offered in a timely manner. So what constitutes the clinical high-risk state? Basically, there are two separate syndromes, and meeting criteria for either constitutes meeting criteria for CHR. BLIPS, or brief, limited, intermittent psychotic symptoms, is defined as the development of threshold psychotic symptoms that appear for short periods of time and resolve on their own. Attenuated psychosis syndrome is defined as having mild, attenuated psychotic symptoms like paranoid ideation, delusional ideas with some insight, speech that is difficult to follow but not completely disorganized, or hallucinations that have developed within the past year and occur about once per week. Note, therefore, that the symptoms do not need to be present on a daily basis, and in fact, they usually wax and wane. I am sure you are wondering by now, how many of these patients develop full-blown psychosis? A reasonable number to quote would be to say that about 1/3 of CHR patients will develop acute psychosis within the next couple of years. So we have said that 1/3 of these patients develop psychosis. What then happens to the 2/3 who don't? Overall, this is not a well-functioning group of young people. Because these young people are struggling, they do need mental health supports regardless of whether they develop psychosis or not. The majority go on to have other psychiatric disorders, most commonly depression, anxiety, and substance abuse. Randomized clinical trials have shown that targeted intervention programs for CHR individuals can reduce rates of conversion to psychosis, improve outcomes should psychosis inevitably occur, and reduce the duration of untreated psychosis, as well as the need for hospital admission for a first episode psychosis. Even the ability to delay the onset of psychosis for a few years is a major win. An extra few years may allow a person to finish their degree or secure employment. One meta-analysis has shown that these programs reduce the overall risk of converting to psychosis at 1 year by 54% with a number needed to treat of 8. So basically you need to treat 8 patients in a CHR clinic to prevent 1 case of psychosis at 1 year. In comparison, the number of cases of hypertension to be treated to prevent 1 stroke is 113. So what are we trying to do with Prospect? We will offer assessment, monitoring, and support for young people meeting criteria for CHR. The ultimate goal is to delay or prevent a psychotic episode altogether and reduce functional decline. We will be doing research to try to further understand the determinants of evolving psychosis. In addition, we would like to increase community understanding about early psychosis. In terms of inclusion criteria, we'll accept patients between the ages of 14 to 30 who meet criteria for BLIPS or for attenuated psychosis syndrome. Exclusion criteria include patients already having experienced a psychotic episode, having received treatment with antipsychotic medications at minimally effective antipsychotic doses for more than 2 weeks, medical conditions or intellectual delay playing a causative role in the symptoms, and substances clearly playing a causative role in the symptoms. Now, I would like to be very clear that a daily marijuana user would absolutely not be excluded from our program. Marijuana is one of the biggest risk factors for psychosis and schizophrenia and represents a major modifiable risk factor that we may be able to alter to reduce the risk of psychosis. With regards to previous antipsychotic treatment, in keeping with national guidelines, antipsychotic medications are not indicated in this population, and we suggest you not start a patient on them. However, someone taking a low dose of an antipsychotic for another reason, such as Seroquel at a low dose for sleep, would still be eligible for our program. All referrals to Prospect will be screened by our intake coordinator via telephone within a couple of days. On the phone, he will complete what is called the PRIME screening questionnaire. Individuals meeting a certain threshold will be accepted for assessment. Our intention is to offer an assessment within 2 weeks. Patients will then be assessed by a psychiatrist, and individuals meeting criteria for CHR based on the Structured Interview for Psychosis Risk Syndromes, the SIPS, will be accepted to Prospect. Prospect patients will be followed regularly by psychiatrists to evaluate for progression of psychotic symptoms and for treatment of comorbidities. Psychoeducation will be provided in a non-stigmatizing way, emphasizing hope and functional recovery. CBT-based groups will be offered, which will focus on stress management, community engagement, and problem solving. Finally, any patient who converts to psychosis will be offered treatment as soon as possible and will transition to the PEPP, or first episode psychosis, model of care without having to switch physicians. So here's a case that illustrates a patient with attenuated psychosis syndrome. So this is a 17-year-old male who endorses vague anxiety for the past 6 months. The family describes this anxiety as completely new. The family are quite concerned as his grades aren't as good as they used to be, and he hasn't wanted to participate in his usual activities. He reports feeling as though his peers are talking about him behind his back. However, he states that when he really thinks about it, he comes to the conclusion that most likely they're not talking about him. He also recognizes that he sometimes feels that songs on the radio pertain to him, but states he knows that this is crazy. He reports that he sometimes feels like he can hear things when nothing is there. He can't hear specific voices, but says it sounds like a TV is on in the background that he can't quite make out. This happens approximately once per week. He additionally reports that he sometimes worries that people can hear his thoughts. Again, he recognizes this doesn't make sense, but this thought keeps coming to his mind. He admits to using marijuana a few times per week, but denies using other drugs. I'd like to highlight a few important points about this case. So, a person actually would only need one attenuated psychotic symptom to meet criteria for Prospect. However, I intentionally described many in this example to illustrate what some of the symptoms may be. Also note that this person's chief complaint is anxiety. Most of these patients will present with anxiety and depression as their chief complaint. However, upon questioning, the social anxiety is a little atypical. It's brand new in onset, and it surrounds people talking about him and people potentially knowing his thoughts. In addition, the decline in school functioning is concerning and doesn't really seem to be in keeping with a mild anxiety disorder. His symptoms would be considered to be attenuated psychotic symptoms as opposed to full-blown psychosis because he doesn't believe them with full conviction. He recognizes they don't make sense, and the auditory hallucinations are very vague and difficult to make out. However, these symptoms are still very distressing to him and are interfering with his functioning. He uses some marijuana use, but no other drugs are present that could explain these symptoms. Thank you very much for listening to this presentation. Please keep this clinic in mind when seeing patients and consider referring any patient who you think may meet criteria. Note that we also accept referrals from patients themselves or their families. The same referral form is used for Prospect as for PEPP, our first episode psychosis program. Referrals can be completed online through our website, or a referral form can be printed out and faxed or emailed in. For troubleshooting around a referral or to find out more about our program, please call the telephone number provided on the slide. If a particular patient is reluctant to be seen in a hospital setting, we may be able to make arrangements to connect with them in the community. We need your support to make this program successful. Again, please reach out if you have any questions at all or if you'd like to discuss a case who you are not sure would be a fit for Prospect. Thank you very much for listening, and please spread the word about our program.